So guys, do moms get a gift of a child and stand a chance of losing a tooth? I'm asking so because for the years that I have served as an oral health practitioner, there are these theories that I get to hear from patients, and I know for sure maybe you have had them as well. And patient will be like, I have never had teeth issues until I got pregnant. Or I have low calcium levels because I shared them with my baby and my teeth are now loose, they're breaking off. Sorry, before I get on to the video, forgive my manners for not introducing myself. This is your tooth doctor, Maureen Mora. Thank you for joining this oral health squad. All we do here is talk matters oral health, and it is simply because I believe everybody is entitled to good oral health status. So on to our video today. Is it really a coincidence that there's a link between pregnancy and teeth, or the general well-being of patients? From a scientific evidence, these theories are 101% false. However, there are some factors that predispose a pregnant mother during that journey that the mom is pregnant. There are some factors that can predispose them to getting oral health issues maybe during or even after the pregnancy. In today's video, I want to take you through some of these factors that pregnancy hormones can cause to a mom, and hence some of you will be so much rigid to these theories, and also I'll be giving you some few tips on how to go about it. So number one, we have gum problems. These are basically pregnancy-induced conditions, as much as some of the pregnant moms might practice good oral hygiene, and they include like gingivitis, which is the infection of the gums, and this one mostly we find it in the second trimester of pregnancy. We also have periodontal diseases. This is an infection of the structures that support the tooth, that is the gums, the ligament, and the bone as well. And mostly this is caused by untreated gingivitis mentioned above. We also have pregnancy epilis or pyogenic granulomas. These are red, round inflammations around your gums that usually have a tendency to bleeding whenever the patient is brushing their teeth. So both the gingivitis and the pyogenic granulomas are not harmful to your teeth, and in most cases they might subside once the mom has given birth to their bundle of joy. However, one thing that pregnant mothers should not forget: the health of their mouth can affect their child, and not the other way around. There are a couple of scientific studies done outside there explaining how the health of your gums can increase your fertility rates. And that was even evident from the guests that we had here on this show, where we were talking about risk factors that can be associated with your oral hygiene status. If you haven't watched that out, please make an effort. I think I will leave the link in the description box. You check that out. There's a lot more that you don't want to miss out. Another factor is nausea and vomiting. Here, you find out that the pregnancy hormones tend to soften the ring of muscles that retains food in the stomach. So that being said, you find that most moms, when they are pregnant, they are more susceptible to nausea and vomiting, or even morning sickness. These might last especially for the first trimester, and disappear thereafter. And for some, which is not so always, it can last throughout the pregnancy journey. And this is dental concern for us, because now once you are vomiting, there is those gastric reflux and the acid exposure to your teeth. A prolonged period of that can subject your teeth to damaging the enamel, which can later on lead to some dental issues like sensitivity and staining of your teeth, or even cavities as well. So if you are experiencing morning sickness, vomiting many a times, these are a few key tips I want you to always put into consideration. Tip number 1, avoid brushing your teeth immediately after vomiting, because now you find that your teeth are already covered with the acid reflux from the acids from your stomach. If you do that, it is gonna scratch your enamel, predisposing it to easily picking stains and developing cavities as well. Number 2, rinse your mouth with a lot of water, especially after the vomiting. Then complement that with the use of fluoridated mouthwash. However, if you don't have a fluoride mouthwash, take a little bit of your fluoride toothpaste, smear it on your teeth, and then rinse thoroughly with water. Once you've done all that, kindly wait for at least 1 hour before brushing your teeth, because if now you try to put these tips into place, at least you are not going to subject your teeth to more of these dental problems. Another factor is retching or gagging while brushing your teeth. Here you find that some pregnant mothers may experience the gag reflex whenever they are brushing their teeth. This is simply because now it's the body trying to react to that foreign stuff getting on the back of your teeth. So if you have this tendency of gagging, especially when you are brushing your teeth, it might prompt some of the pregnant mothers not to want to brush their teeth. But honestly, brushing your teeth is very important in controlling most, if not all, of the dental problems. So simply, maybe because it is a condition you are in at that time, here are a few tips that are going to help you to at least get to brush your teeth at the end of the day. Number 1, if your brush, or rather, try and get a brush that has a small head. There's a video I did talking about different types of toothbrush. So try and get a brush that has a small head, because now that one can easily get on the back of your teeth without majorly causing you to gag. However, if you are not in a position to get that, please do get a toddler's toothbrush. And then try and concentrate on this might help. Try close your eyes and concentrate on your breathing whenever you are brushing your teeth. Also, you can try to listen to music. It might help as well. If the toothpaste you're using at that point causes you to gag, I'll advise that you get to change to another brand which is not provoking you. But then if all, which I don't think all of them can not work, you can use water, you brush with water, and then you gargle with the fluoridated mouthwash. So lastly, guys, whenever you are brushing your teeth, be as gentle as you can. Go slowly. Do not be in a rush. I believe these tips are going to help you be able to brush your teeth at the end of the day and not brush your teeth because you are worried about the gagging and all that. And on to our last, I think, factor of the day is food cravings. So here you find that most mothers, whenever they are pregnant, they have these crazy cravings to foods, drinks, and all that. So if it happens that you are purely craving on sweetened foods, then your teeth are at risk of either having those cavities, because now there's nothing the mouth bacteria love like sugars. So if you consume a lot of sugars during your pregnancy journey, you are creating an environment in your mouth that is going to multiply the bacteria there, which at the end of the day are going to produce some bad acids that will destroy your teeth. So then after the delivery, probably you are going now to start blaming your little angel for sucking your calcium. So it is some of these things that you are doing, especially craving for those sugary foods like sweets, chocolates, cake, and all that. And remember, they are also sticky. So if your pregnancy tells you that now you should only consume sugary stuffs and you cannot avoid that, please ensure that your oral hygiene status are perfect. And now that will force you to always also to get the regular dental checkup with your dentist, at least to help you have good oral hygiene status that will not affect you or your baby in any way. So guys, that is it from me for today. I hope you've gotten to learn something. Kindly feel free to share this message. It might end up helping someone somewhere. Till next time, let us meet in my next video.